Yes, I'm Liz Tayler, and I work in the Secretariat of the Antimicrobial Resistance Secretariat in WHO headquarters. I'm a public health physician who's worked both in the UK on quality and infection prevention and control, and a large amount of time in Africa, primarily on setting up health programs, but also water and education programs. One was very aware of the problem with TB, and malaria and HIV, but resistance to bacteria is not something that I was particularly aware of until relatively recently. And I think this is one of the challenges, that in low-income countries there are so many other problems, and we don't have the data and we can't identify resistance. So we tend to not be aware of what a threat it is and what a problem it currently is. In 2015, the World Health Assembly approved the Global Action Plan to address antimicrobial resistance, and all member states committed to develop their own national action plans to address AMR. And at the same time, the governing bodies of FAO and OIE also endorsed the Global Action Plan. And countries committed by 2017, by the Assembly in 2017, to have developed their own national action plans aligned with the GAP. And so we have a small secretariat within headquarters that is supporting the implementation of that Global Action Plan and supporting, through the regional offices, countries in developing their national action plans. But a lot of the work around these action plans, around preventing infection, around appropriate use of antibiotics, around surveillance and resistance and things, is actually going on across the organisation.
Okay, thank you.
Well, first of all, sick animals and sick humans need antibiotics to manage infections. And it's very important that we preserve the effectiveness of the drugs for those two uses. But antimicrobial resistance develops, and develops so fast, because of inappropriate use of antibiotics. And when the bacteria are exposed to the drugs, resistance comes. And at the moment, we're exposing bacteria to antibiotics through giving them to humans and animals when they're sick, but also it's being used quite widely in growth promotion to accelerate the growth of antibiotics. Antibiotics are peed out into the environment, so about 70% of the drugs that you take if you have an infection will actually be peed out unchanged. And that means there's quite a problem both downstream from hospitals and downstream from the slurry from animal waste of residues getting into the environment, and resistant bugs getting into the environment and spreading between them. And it's really very complicated to work out all the different mechanisms whereby food chains interact, whereby the environment, humans, animals come into contact. But the more that we're all coming into contact, the greater the risks of resistance developing, and the greater the risks of, when the resistance does develop, of it spreading. So we know that, for example, in those countries that feed a lot of fluoroquinolones, ciprofloxacin, those sorts of drugs, to their chickens, the resistance in humans, the rates of resistance in humans and the bugs that we find, is much higher. We're also, now that we can do genetic typing and actually trace the bugs and identify the fingerprint of the bugs, last year there was a great deal of concern because colistin, which is the sort of drug of last resort, if all other drugs have failed and you're in an intensive care unit, people use colistin. It's not a very nice drug because it's very rough on your kidneys and everything else, but we're having to use it more and more. And resistance to this drug of last resort was found. And what was interesting was that when you looked at the pig production, there were very high levels of this gene MCR1 in Chinese pigs. There was quite a lot in Chinese pork and the meat. And then the same bug, the same bacterial type, was found in humans. And since it was identified in November 2015 and published in The Lancet, I think there are now 14 countries where we're finding this bug. So there is more and more evidence of spread between human and animal sectors, and then within those sectors. And this is a shared problem. We're absolutely not going to get into a blame game of who's causing the resistance, and it has to be something that we address as a society together, and both human and animal sectors and the environment and crop production all starting to say we need to get better at reducing infection and using the drugs more appropriately so that we will be able to continue to use these drugs effectively for our children and grandchildren. I suppose it's also a One Health issue because of its impact. And so again last year there was quite a big report, the O'Neill report, done by an economist, not a public health person, so he came to the topic fresh. And he has estimated that if we don't take action, there will be probably about 10 million deaths per year because of antimicrobial resistance. Most of those in Africa and Asia, about 4 billion, over 4 million in both Africa and Asia. But the impact on the economy will be between 2.5% and 3% fall in global GDP. And that, again, a lot of that is in decreased productivity and impact on the agriculture and livestock sector. Some people thought that these numbers were pretty scary and perhaps he was exaggerating the problem. And the World Bank has also done a review that they published last year, and they used a completely different methodology, but again came up with similar sort of orders of magnitude of figures, similar problems to the 2008 financial crisis, but going on for much longer. A 2.5 to 3-4% decrease in livestock production overall, or livestock productivity, but in developing countries it would be 4 or even up to 10% fall if we don't address AMR properly. So obviously the human sector is very involved because we are so reliant on antibiotics for treatment of all common infections and as a safety net for surgical procedures, for cancer treatment, for all those sorts of things. And a lot of the gains that have been made in the MDGs, in maternal and child health, have been associated with access to cheap, effective antibiotics. But we know that we are using antibiotics inappropriately, and we need to get better at preventing infections and at using the drugs appropriately. In the US, which has done quite a lot of work on this, probably a third of prescriptions are inappropriate. In low-income countries with fewer health workers, where most people self-medicate, buy drugs over the counter, that problem is much, much, much higher. So we do need to get better at using the drugs in human health and preventing infections. But there's a similar thing that needs to be done in the animal sector, and I think everybody now agrees that feeding antibiotics to healthy animals is not a good thing because it's fueling resistance. And FAO and OI and everybody has agreed that it needs to be phased out. And similarly, the animal sector needs to get better at infection prevention and biosecurity through scaled-up immunisation, through better hygiene practices, through better slaughtering practices, so that the reliance on antibiotics is lower and that there are fewer antibiotics in the food and resistant bugs, and then we need better at food safety to prevent them spreading. Interestingly, antibiotics get everywhere, and they're also used in the crop sector, and I think people are wondering whether that is ever really appropriate and whether there should be alternatives. The environment is really important because obviously that's a driver of infection and a spread of resistance. So we need to get better at managing the environment, both human excreta, water, environmental sanitation, hygiene, but also pollution from hospitals, pollution from the production of these drugs, and from the big slurry from animal production. There are certainly some rivers in India and China where people are getting therapeutic doses of antibiotics in their drinking water all the time, simply because there's so much waste from manufacturer. And that cannot be good for those people, because they're going to lose, all the bugs, the resistance in their microflora is going to be enormous. Trade is also very important, and we need to encourage those countries that are trying to protect their populations, such as the EU, that have got some quite stringent regulation about not using antibiotics in growth promotion, that is respected, and so that it's not used as a barrier to trade, but also that the public health concerns are important. So it fits with Codex Alimentarius and a lot of the trade issues. It's also important because one of the concerns about resistance was one of the drivers for the fall in productivity that the World Bank modelled. So we need to make sure that trade people are involved, that there is good quantification of antibiotic imports and the quality of the drugs that are being used, because substandard drugs are also really important. And then there are other sectors, obviously ministries of finance and development need to be involved, tourism, a whole range of other drugs. As this becomes more and more important societally, other sectors are going to have a stake in it. Around the Brazil Olympics, there was concern about resistance, and was this going to be a risk for the sailors because there were resistant bugs around. If people are in countries have a large amount of health tourism, for example, there may start to be concern about resistance patterns and spread of resistance through people going to other countries for treatment. So it's really quite a complex, messy area, and that's why we advocate that every country has a One Health approach to make sure that all interests are appropriately covered and balanced.